Hello and welcome to Baby Health. I am Dr. Sandip Gupta, Senior Pediatrician and Childcare Expert. So today I am going to answer a very important question of a situation which happens for young parents sometimes. This is about breath holding spells. So sometimes the babies who are actually crying or are angry or suddenly get any injury by hitting some door or falling on the ground may stop breathing suddenly, so which is a very panic situation for parents, and they get very threatened and anxious about it, and they come running to our clinic or they call me in a very panic state and anxious state asking, doctor, what should I do? So today I am going to clarify all the doubts about it, why it happens, what you should do, and when you should come to a doctor when you are having a breath holding spell. So breath holding spell is usually happens between the 6 months to 2 years of age children. Children sometimes when they are getting some noxious stimuli, like they fall on the ground or hit their head on a wall or the ground, suddenly start crying and suddenly stop breathing while crying, or they may be very stubborn about something like some toys or some food, and when that is not given they may just hold their breath. So at the time of holding their breath, what happens is certain times they will turn blue or pale, and because of that parents actually become very threatened and anxious and panicked, and they cannot understand what to do. So this is a very common phenomenon in like out of 105 children may have this kind of problem between the age of 6 months to 2 years, and this may happen because of many reasons, and the causes are not very clear, but mostly it happens because of some genetic reasons. It has been seen the parents who had similar kind of behavior in their childhood, their children turn out to be having similar kind of behavior. Also it has been associated with iron deficiency anemia. So iron is very important for children's growth, and sometimes because of lack of iron this kind of behavior comes, and children who are generally stubborn also kind of have higher tendency to develop this kind of breath holding spells. So what is breath holding spells? I explained to you, and why it happens. Now what to do when the child is having breath holding spells? So in general, if the child is having breath holding spell, first thing is not to get too much panic. Usually the breath holding spell can resolve by itself within 1 to 2 minutes. So 1 to 2 minutes child will actually start breathing again, and at the time of breath holding spell what you should do is turn the child's head to one side. Make sure there is nothing in the child's mouth. If any chocolate or toffee or any food particle is there, you just remove. If the child is actually frothing, you just remove the saliva and keep the child turn one side. You can sprinkle a small amount of water, normal temperature water, on the baby's face. That actually sometimes triggers the child to breathe again, and just cuddle the baby and talk to the baby. So with these, mostly 99% times the child will come back to a breathing state. Sometimes if it is more than 2 to 5 minutes prolonged breath holding, the child may actually be at risk of some injury, some problems. So you should that time contact your doctor and rush to the clinic. In the clinic usually what we do is we actually try to stimulate the baby and give oxygen, and most of the time child recovers. Very few times child may also develop seizures because of this breath holding spell, and which is a serious concern. So that time again you should come to the doctor. Apart from this breath holding spell, there are certain similar kind of spells, something called TET spell or cyanotic spell, which happens in babies who have had congenital heart disease like tetralogy of Fallot or similar kind of disease. So what is the difference between them and the breath holding spell is, breath holding spell child turns blue only when the spell happens, whereas tetralogy of Fallot or congenital heart disease babies, they will be blue all throughout, and the blueness increases during this crying spells. Apart from that, seizures is one more condition where baby may have jerky or irregular breathing, but seizures babies usually don't turn blue in early stages, and they have shaking movements of hands and feet, which is less likely in breath holding spell. So this is how you differentiate. But if you have any of these concerns, actually you should turn the child's head one side and make sure that nothing is in their baby's mouth, and don't try to give anything in the mouth at that time. And if this is prolonged, you come to the hospital or the nearest clinic. Thank you for listening to our videos. Hope this video is very helpful for you. If you find this video is helpful, do subscribe to our YouTube channel and share it with all the parents who may use this information. Thank you.